Good morning, sir. Thank you for honoring us with your presence at Medicaid Cancer Foundation today. Well, you're obviously quite well known within the oncology space. Thank you for all the amazing work that you do. But for the benefits of our audience today, can you please introduce yourself and give us a brief background?
Okay, thank you, Fatih. Nice to meet you. I'm happy that you have moved on and making a great impact from this place where you are. My name is Dr. Chinedu Senior Ara, Senior Consultant Radiation and Clinical Oncologist and former Head of Department of Oncology, National Hospital. I'm a Senior Lecturer at the University of Abuja. It's a pleasure to meet you. Thank you.
Sir, September is the Ovarian Cancer Awareness Month. Now, the conversations about cancer are increasing in direct relationship, of course, to the increase in the incidence of cases, unfortunately, the mortality as well. But we still have a good number of people that are unaware of what exactly the different types of cancers are. So please, can you tell our audience about ovarian cancer, what it is, and some statistics, the incidence, especially in Nigeria, and the mortality rate as well?
Okay, thank you, Dr. Fatih. Actually, the caption for this World Ovarian Awareness Month is no woman should be left behind. The aim is that we should be able to carry the women forward along in terms of this journey on cancer. And what you can do is to equip the people with information. When they equip people with information, they're able to sort out themselves. And if there's appropriate intervention, some of these cancers we are talking about, especially ovarian cancer, which is a silent killer because of its insidious onset, and most often is asymptomatic. If you're able to give a lot of people, especially women, food information, they were able to take care of themselves by going on routine screening tests. So averagely, we look at the number of women in Nigeria. Nigeria has a population of about 206 million people, and out of that 206 million people, 61 million are women. Even at the metastatic stage, the germ cell tumors are pure. So the basic thing is that in Nigeria, we are having this problem of not accessing the health facility, not undergoing screening tests, and not people being aware of this cancer. So overall, the cancer incidence, especially ovarian cancer, tend to present very late, and the outcome is very, very poor. So I'm very happy that you are taking up the challenge to create this awareness, seizing the opportunity of this, that no woman should be left behind. Thank you. And leave signs, most often they don't leave signs until they are very, 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 very in advanced stage. That means that a patient must go for screening tests. That's the reason why a patient must go to, because there will be no sign. So, but for those that are already in advanced stage and signs are coming, most of the signs that come is that there will be bloating, abdominal bloating, increase in abdominal size of the abdomen because of what we call ascites. There may be bleeding, and there may be pressure on the bladder and the rectum. So the patient is feeling like he wants to go and poop, but there's nothing that will. Then there may be a situation whereby the cancer will spread to the lungs, and when it spreads to the lungs, there will be difficulty in respiration, easy tiredness, easy fullness. Before the patient will eat small food, is feeling that so then there may be weight loss. And one of the things that you see in ovarian cancer is that patient abdomen is big, the leg and the other part of the body is shrunken, so you look at the egg on the stick appearance. So because of wasting, the patient is not eating adequately. So these are the major presentation. But the ovarian cancer is not limited to the spreading to the lungs. It only spreads within the general abdomen, in which case the whole of the peritoneum, the covering of the abdomen is dotted with cancer cells, and that equally extends to the liver. And with extension of the liver, there will be cascade of events that are going to lead to other complications that you see. So that's a major. So what does the doctor see when it comes to when a patient comes? That's the signs that the patient and the doctor elicits, because all those ones we are talking about symptoms. What you elicit that you're going to see increase in abdominal size, and equally you can palpate some of the tumors if they are big. Then you can see that there may be anemia, whereby there's lack of blood because of poor nutrition, and you can see a lot of wasting because the patient is not eating very well.
So in the way of cancers, it takes over the entire body.
Completely. Yeah, that's what the patient is almost going down the drain. I will see the patient also, and the patient will equally complain to you that the abdomen, they feel bloated.
So I'm really happy you painted this picture, because it goes to show like what the actual picture is, because now then people are worried. I'm sure for anyone watching, the next question is, okay, how do I protect myself? How do I protect myself against this? Now there are preventive measures for that, but there are also some screening tests that these women can do. Please, can you talk to us about some of the screening tests?
Okay. Majority of the screening tests we do for ovarian cancer is that we look at some of the cancer antigens, which we call CA125. Then, because I mentioned germ cell tumors, sex cord stromal tumors, there are other tests we call it to rule out this one. We call it beta HCG, even placenta lactate dehydrogenase, and equally lactate dehydrogenase, and other enzymes that may be elevated, like liver enzymes. So we look at all those things as part of the screening test. Then apart from that, we equally do appropriate ultrasound. The appropriate ultrasound is
such a powerful statement, and I really like that. Now, for the women at home that truly do not want to get left behind when it comes to ovarian cancer, what should they be on the lookout for? Like you mentioned, the signs and symptoms often come in late. However, they do come in. So what should they be on the lookout for? Or rather, even before the signs and symptoms come in, how do they screen? How do they protect themselves against this devastating disease? Unfortunately, conversations around ovarian cancer are very few. Like breast and cervical cancer now is more well known. I mean, almost everyone will tell you, even if they've not had a pap smear, they've heard of a pap smear, or they know to get a screening mammogram or a breast scan. So how do we really have these conversations around ovarian cancer? What are women supposed to do? What are they supposed to do?
Okay, thank you, Dr. Patsy. For the women that's in the village, and most of the things we do about cancer awareness is always a township affair. And if we're able to stretch ourselves further, there's every need for us to break down this information in different native languages and different radio jingles, and TV, and even village town crier can get people informed about this. And if government will strengthen itself a little bit, there should be a symposium that should be organized equally for the women in the village, not only for the women in the town. Because in the town, you see the governor's wife, the president's wife, the wife, senator's wife. So, for the benefit of those who are not in this category, who don't have this opportunity, I would say that what they need to look at is that ovarian cancer most often deadly disease that has everything that weighs a woman down, especially its debilitating nature. So what they need to do is that first of all, they must at least go down in terms of looking at preventive factors, because that is the one that they can easily assess and at least know for now. One of these is that we talk about pregnancy. Pregnancy is one of the preventive factors in ovarian cancer. So, and the reason is that it tends to slow down one of the move that fue very good. Cancer growth. So pregnancy is preventive. So a woman marrying and giving birth before the age of 30 is preventive. Then somehow the use of though people do not advocate for the use of contraceptives, but we have found out that the use of contraceptives, other contraceptives, do help is slowing down. It's up to 85%. Yeah, curability. But the major problem why we're here and discussing is that because we normally present at late stage 3 and stage 4 for most patients.
Because we do not screen.
Yes, no screening test, no aware. Because I mentioned it's asymptomatic, and because of the volume of the abdomen where the cancer grew, so the cancer have to grow quite a long time and covering the stomach and downstairs this signal of pain. That's when the patient will detect that as a problem. So at any stage, you may not notice anything.
Thank you, sir. So I want to go back to, you mentioned about the women in rural areas. Now, for us here in an urban area, it's easy to walk into almost any healthcare facility around you can offer you an abdominal pelvic scan. And with that, at least you know that you're halfway there, even if you don't do your tumor markers. But for some of these women, they don't have access to these healthcare facilities. What they might have is a primary healthcare center that does not offer some of these specialized tests, that does not have this equipment. So how do you think we can, so some equity here is really what I'm thinking of. How do you think we can spread this to them? How do we bring them into this and take care of them and protect them as well?
For a functional health system, there's a chain of referral. And I remember when I was doing some journals about equity, I was trying to strengthen the grassroots health, especially the primary health system, which is the grassroots. So what we need to do is nothing than to strengthen our primary health care so that the chain of referral system is functional. If you now look at what's happening in Nigeria now, even everywhere, is that there's a break in this referral system. That's why you see a patient that have malaria coming to national hospital for malaria. What national hospital should treat is conjugated malaria, not malaria. So malaria should have handled at the primary health level or at the secondary before coming to the national hospital. Or if you are going to the teaching hospital, the person is going there because they have malaria. That's not supposed to be. Should have handled that. So you see that there's a break in the chain of our referral. So all you need to do is to go back, then strengthen our primary health care, then recruit the appropriate health personnel, and equally recruit the SQ, essential health workers, who goes in the hinterland with, who are very conversant with the villagers to bring this health information down to them in their own native language. And with that, they were able to have a quick intervention once something's happening.
So, which means that we can hopefully try to make care accessible to everyone at their own level if we're able to get the health system.
Yes.
Thank you so much, sir. Thank you for sharing a little from your vast wealth of knowledge with us. I think we're all better informed now that ovarian cancer is a cancer of every woman of reproductive age, and we need to take measures to make sure that we screen and protect ourselves, because the symptoms often present late, and that complicates diagnosis as well as treatment. Thank you for coming in today, sir.
Thank you.